Welcome to Sexology, a podcast that untangles the science of sex and pleasure. And now, with this week's episode, your host, clinical psychologist, Dr. Nazanin Moali.
Hello there. You're listening to episode 192 of Sexology Podcast. I'm your host, Dr. Nazanin Moali. If you haven't had a chance yet to take our lover quiz, I invite you to check it out. I read several studies around what makes someone a good lover, and I developed this quiz based on those findings. So if you are curious to know which type of lover are you, and more importantly, what can you do if there are areas that you need to improve on, you can take our quiz. The link is in the show notes, and it takes about 5 to 6 minutes. Today we're going to talk about medication, and specifically medication that's been used for addressing sexual dysfunctions. Many times people, men and women, come to my practice and they feel defective. They read maybe a couple books about sexual health and sex ed. Maybe they saw a therapist that he or she was not specialized in sex therapy, and they didn't get better. And they feel defective. They feel like they will never have the sex life that they want. That's why that I think it's important to be aware of the options out there, because there are hundreds of different approaches that you can take when it comes to problem solving your sexual challenges, and medication can be part of those solutions. There are tons of wonderful medication specifically for addressing sexual dysfunctions. We're going to talk about the ones for women and men, and we're going to talk about some procedures that people are using to improve their sexual health. As you guys know, I'm a sex therapist and I'm a psychologist, so talking about medication in depth would be outside of my scope. That's why I invited a wonderful psychiatrist to come talk to us about some of these evidence-based medications that he's prescribing to his clients. Our guest is Dr. Amir Mohebbi. He had him on previous episodes. He's very insightful. He is a proud Iranian-American, currently completing his psychiatry residency at St. Louis University. He presented a number of different conferences, and he has lots of accolades. My invitation for you is to check out his full bio in the show notes if you want to understand and learn more about him. Also, I have an announcement at end of the episode, so make sure you're listening till the end. Without further ado, here's my conversation with Dr. Amir Mohebbi. Hello and welcome to another episode of Sexology Podcast. I am so excited and honored to have Dr. Amir Mohebbi back on our show. Dr. Mohebbi, welcome to our show.
Hey, thank you, Dr. Moali. It's great. I'm happy to be here yet again. This is a great show. I love it. And I love patient education. Hopefully we can keep doing this.
Yes, I'm very excited. So last time we talked about the impact of various psychiatric medication that people are taking and their impact on their sexuality. And I wanted us to kind of focus this time on the other side of the spectrum, on the medication that actually and treatment that actually help people to function better when it comes to sex and sexuality. Sometimes it's my experience that the combination of sex therapy with taking medication can transform people's sexual wellness. So I'm going to start talking about focusing on the women. I see a lot of women in my practice. Many of them, they struggle with a various form of experiencing painful intercourse. And I know that there are some medical solutions for them that's been very effective, because what I've seen, at least in my practice, historically, since sex is painful, what people do is avoid it, and they don't know there's a solution around it. We're definitely, as a sex therapist, help people to address some of the behavioral component of this challenge. But please tell us, is there any medical treatment for this condition?
Definitely, there is. Formerly, we call it dyspareunia, and it's often associated with different kind of, OB-GYN type issues. It can be caused by uterine fibroids, endometriosis, or sometimes a woman's anatomy is such that it might lead to more pain. And then, this can be very distressing. So for me as a psychiatrist, I encounter this when patients come to me and they're very distressed that sex is this thing that society says should be amazing, should be great, but for them it's a very painful experience and it causes issues with their intimate life. And so, with that said, I have to do a very thorough history and physical to see what's really the cause of it. Very rarely there's a psychiatric cause that's, leading to the pain. But, it's interesting though that antidepressants have been used for this to actually, because of these, reports that it may cause some genital numbing. So for those that have issues with the spasms, or with any kind of pain or persistent arousal, then, an easy first-line medication that can be tried without a lot of side effects is an antidepressant. But recently, there's been more newer developments that are more promising. For example, Botox. Botox, it's, most people are familiar with it for its cosmetic reasons. I use it for my hyperhidrosis, but actually for women, it's been very helpful for the painful intercourse, including the spasms, and even for the persistent genital arousal. So yeah, that's, it really depends on how severe the symptoms are and how they last. Of course, if it's caused by something like a fibroid or endometriosis, the treatment would be to treat those underlying causes. But otherwise, we would try an antidepressant or something like Botox.
Well, it's interesting that I certainly heard about Botox and I had clients that they used it and it was successful for them. I recently read this article published that was provided, like forwarded to me by another sex therapist, that some people were using PRP as a way for like helping women who are struggling with struggles around painful sex or lack of orgasm. Is that something that you have been exposed to?
Yeah, I have, but are you referring to PRP as the platelet-rich plasma? Is that correct? Yeah, and so, this is something that's more often used in like sports medicine. And so it doesn't come across my practice much. I mean, I've read about it being used, and I think the idea there is that blood flow is part of the issue. And when you have spasms, it's often because a certain part of your body, it went without oxygen for a couple of seconds due to how the vessels are spasming. So what this platelet-rich plasma does is that it's more viscous, so it keeps the blood vessels a little bit more open, allows for better flow. If there's better blood flow, then it's easier to keep the vagina lubricated. There's not going to be spasming in the muscles, those kind of things. But it's, it hasn't been clearly defined, but that's kind of how it's hypothesized to benefit.
Interesting. When it comes to medical interventions, I'm super hesitant to refer people out for something that I haven't heard about as much. And that's one of those newer things. But it's good that you can at least the hypothesis, you see that can be something that could be possibly useful. When it comes to women's sexual wellness, one of the time that my clients, I notice they have the hardest time is postmenopausal period. I have clients in my practice that they're coming in and telling me that, okay, sex was great. I never had issues with not being able to experience joy during orgasm, but due to the changes in my body post-menopause, now sex is painful. I'm not able to reach orgasm. They just people feel very, very frustrated. What are some of the recommendations you have for those women?
Yeah, and that's a great segue, because even the younger women with painful intercourse and stuff may also benefit for some of these treatments that are used to help women that have postmenopausal issues. Menopause is basically describing when ovulation stops, and this affects how a woman's estrogen levels are in her body. And estrogen usually maintains a lot of the functions that are needed for sex that's enjoyable, So a lot of the pain in postmenopause is due to atrophy of the vagina. It literally gets smaller, it gets drier. So that's why, often lubrications are recommended. But here lately, they've actually developed a gel that is inserted vaginally of oxytocin. Now, oxytocin is the orgasm neurotransmitter, and it has very high promising results for increasing desire, arousal, lubrication, satisfaction. The only thing that it didn't do was decrease the time to orgasm, but otherwise the oxytocin gel was very effective. Now, it's not commercially available yet because it's still under testing, but there is an FDA-approved medication to treat the sexual issues, and it's called philbentherin, but essentially it is like a newer type of serotonin medication where it increases it at one area but decreases it at another area, and the combined effect is supposed to kind of augment, the pain and the displeasure that occurs in menopause. Now, OB/GYN doctors love to use the medication Effexor or venlafaxine, and that is actually an antidepressant medication. Technically, it's an SNRI because it works more on norepinephrine, but it's through that activity that it lowers hot flashes. So, the discomfort with the hot flashes and being sweaty is often a barrier in SAGs, and the others are the, kind of the atrophy that occurs in the vagina and the dryness. The antidepressant that I mentioned earlier, bupropion or Wellbutrin, which is one of my favorites, it has a lot of great benefits in the same regard, and it's very similar to Effexor. So I would actually prefer the bupropion. Testosterone has also been used. Testosterone to kind of offset this drop in estrogen that's seen in women postmenopausal, but there's concerns over, the side effects on the heart, maybe cancer. So generally, hormone replacement is something that's kind of looked at in more severe cases, And there are medications that work on the estrogen receptors, and some of those have shown to reverse some of the menopausal side effects. So, it really depends on the person, how well that they can tolerate the treatment or how much issues they're having. Just like for every woman, their periods are different. Menopause might be different for them as well.
Well, what a wonderful overview. And what I heard also overall is that there are solutions for this problem, because for many women, kind of like going through menopause kind of brings some sadness and grief, because they feel, okay, that's for some women it's connected with the youth, connected with being able to create life, and they feel kind of, okay, then therefore my sexuality kind of gone in effect, and they feel like they, especially in some part of the culture, people think kind of like sex is something that's for younger people. And when you are around middle age or older, then you don't deserve to have, or it's not possible to have wonderful sexual experiences. But from what I'm hearing, that these are the challenges that can people easily problem solve, and some of them it seems like they're more promising than the other ones, but there is a number of different ways that can people address this. Sometimes I hear hear for some of my clients that they had struggles with desire, that they get prescriptions for Addy. What do you think about that?
Which one is it? AbbVie? Is it ABVE?
Yes, for the desire one, that one that they were hoping that it is the equivalent for Viagra for women.
Oh, yeah. Let me just see what the generic name is. Yeah. So just like for male sexual dysfunction, everyone is familiar with Viagra, and Viagra was discovered for sexual dysfunction by mistake. Actually, initially it was looked at as a blood pressure medication, and then they noticed that people became hairier and that they had more erections, and they started to think about using those medications for hair loss and erectile dysfunction. Now, they tried using the same kind of medication in women, thinking that it would lead to increased lubrication, but that was not effective at all. The medication you're referring to, AbbVie, is a newer medication. It's a antibody that's designed to work at a particular receptors. And, the community is kind of skeptical because we haven't seen the long-term benefits of these. Most of the studies do come out of the, kind of the pharmaceutical realm because they design their own medications. And it's a lot like, chemo medications, where often folks don't have a choice but to try these newer things, and we don't find out about them later. Now, but what you were talking about before, is very important, because often when I discuss menopause with my patients, the first thing that we got to establish is that they are grieving, and folks don't really realize that maybe that's a lot to explain for those feelings, and they have to kind of go through that process. I don't like to get to medications until, that someone has gone through all the right therapy modalities first, because why add more medications to a person's regimen if that's not really the underlying, cause that's causing the issue. There are ways of psychologically stimulating yourself to deal with things like dryness and things like that. But, you do kind of have to process those changes, those quality of life changes first.
Absolutely.
And I know,
yes.
Yeah. Yeah. I was just going to say, the marketing and media draws our attention to these fancy things, but, it's, we have to be skeptical. And in medicine, the rule of thumb is, you want to kind of go with things that are less potent and kind of work your way up if you have to.
I can't agree more. And sometimes, again, with transitional period in life, or especially for many of my female clients, is that there are a grieving that's going on that impacts their sexual wellness. Sometimes because of the changes the body, we have to, in a therapeutic framework, work on helping people to kind of accept their bodies and changes that the body experience, and all of those can impact their reaction and enthusiasm about sex. So yes, I agree with you that there needs to be a holistic kind of like approach. Okay, if there's pain, dryness, all of those things, those are that people think that people can address, but also psychological component of the things, and at times relational component of things important as well. So the other criteria, the other area that I feel like people are very excited about the medication when it comes to male sexual functioning. And it seems like we have at least very good medications that are helping many of the men, at least that I see in my practice. So one of the, again, we talked about Viagra being one of those medications that many men are using when they're struggling with getting an erection. So tell us, what are some of the common medications that people are using if they are struggling with erectile functioning?
Yeah, so that's a great question. Generally for a man to sustain an erection, they need to have the venous blood supply. So that's the blood supply that's coming back to the heart to kind of fill up with blood to kind of sustain and keep their erection. Okay. Now, sometimes people can get there, but they can't keep it. That's where, maybe using different kind of sex toys might help, or a pump. But for folks that even have problem even having an erection, the first line treatment is what we call the phosphodiesterase 5 inhibitors, or sildenafil, which is Viagra, and related medications that all end in fil, so tadalafil, vardenafil, and they only basically differ in their half-life, how long that they last in the body. And generally how these medications work is by a roundabout way of increasing nitrous oxide, which is a chemical that's needed to be released to tell the veins to get big and let blood fill in there. So they work really good, but if you do have problems with low blood pressure, then it can be very dangerous, because by making the veins get really big and kind of collect with blood, it drops the blood pressure because not as much blood is getting back to the heart. Now, if that's the case, if we're dealing with someone who's had a heart attack or their cardiac situation is not really stable, then again, we can go back to the SSRI medications. And if premature ejaculation is the issue, then I would want to use something like paroxetine or Paxil, which has the shortest half-life because it's more potent at dealing with that. Now, if it's something more like erectile dysfunction, I'm going to go to the opposite, something like Prozac or fluoxetine, because it has the longest half-life. One Prozac pill lasts a week in your body. So this is something that you need to sustain. It's much more effective to use something that is more longer acting. Now, pharma, though, has created their own fancy version of these medications called duloxetine, which is FDA approved for this specifically, but it's really just derived from Prozac. And so, it's kind of like expensive Prozac. I wouldn't really use it, but it can be used for that purpose. Now, similarly, other medications that do have antidepressant properties can be very helpful for the premature ejaculation or erectile dysfunction. Pamipramine, which is a tricyclic antidepressant, that is the most effective, and tramadol. So if someone is dealing with chronic pain, the tramadol has the SSRI activity in addition, and that can help offset the erectile dysfunction that might be triggered by pain, for example.
So how does SSRI helping with kind of like helping with erectile functioning? I'm kind of curious about that.
Yeah, so the way that it helps with erectile dysfunction is by mitigating anxiety. Right. And, folks that are anxious, for example, their nerves are more excitable. Their sympathetic system is in overdrive, okay? And it's like they're sitting in a room with a lion the whole time, and their heart is beating really, really quick. And so what the antidepressants do is they kind of mitigate this fight or flight response, and they keep the body kind of more, grounded, so that the blood flow, you have a lower kind of baseline heart rate. You're not as prone to panic attacks. And in a very roundabout way, it actually increases dopamine in different parts of the brain, which increases desire, things like that. And, with increased desire, then comes the rest of the stuff, pretty much.
Well, that makes sense. And so it's kind of addressing the, at times, performance anxiety and anxiety that people are experiencing. And that absolutely makes sense. That would be helpful with kind of sexual functioning. When it comes to medications like Viagra, what I notice is that people are very misinformed. I had clients that they thought, okay, if I'm taking it on its own and the issue will get resolved, or like I'm going to be able to get an erection. But it's my understanding that it needs to be kind of a sexually arousing context, that it's not going to work on when you're not in that context. Is that your experience as well?
Yeah, that's very true. There are a lot of misnomers about Viagra, and you hit a really good one. And it's a lot like with other medications too, that there's a window of opportunity, okay? And so if you miss that window, then it may not work. And folks unintentionally may increase the dose that they need because of those kinds of situations. So you're right. I mean, you want to use the Viagra when you're kind of in the heat of the moment and you're struggling, rather than, taking it before dinner, waiting for the end of the night,
Right.
That's one thing. The other thing is that, we often stray away from wanting to use a medication like Viagra, not just because of the cardiovascular risk, but also because of the tolerance that's associated with it. It's reported that often people become even dependent on it to sustain an erection, and we see these, unfortunately, in younger patients. For example, even, substance abusers who they use a lot of stimulants, which, like they might be abusing cocaine or methamphetamine. This increases their sexual desire, but because their heart's beating so fast, they can't maintain an erection. Then they'll use like a Viagra pill to offset that, and kind of playing teeter-totter with their body. And then it kind of, impacts their body long term. It puts wear and tear, or later that they'll have significant issues, having an erection, for example. It's very challenging.
Absolutely. And I think when it comes to erectile functioning, sex therapy offers tons of good hands-on experiences that people can practice and homeworks. And it's one of those areas that people can address it behaviorally. I personally had clients that they had issues with maintaining erections, and through behavioral strategies, they will able to kind of elongate it and increase the duration of the time that they are able to maintain the erection. And you're right that it's significantly a better way of kind of at times handling the struggle that you're having, knowing that, okay, I'm learned through doing the breath work or different exercises to maintain my erection, versus I need to rely on this medication. And if the opportunity presents itself, but I don't have the medication, psychologically, I'm kind of like putting myself in this place that I'm not going to be able to get an erection.
Absolutely. And, I actually was curious about something that I wanted to ask you, knowing that your office is in LA, near Hollywood. Another main problem with, dysfunction is comorbid with things like eating disorders. Mm-hmm. And this might, affect a woman's ovulation cycle, and, with social media pressure on people to maintain body image. I mean, this is something that we deal with in Southern California a lot. Do you have any of those patients in your practice that are struggling with eating?
Yes. So part of my practice is treatments of eating disorders. I got training at it during my postdoc, and this is something I feel very passionate about. And what's interesting is that with my clients who are, some of them have quote unquote what people think is ideal body, which is like a kind of an anorexic realm. They don't have sexual desire. They say like that's not something they experience, because how their body is in the starvation mode. And when you are in the starvation mode, then sexual desire is not necessarily present for you. So when I do treatments of eating disorders, when people start weight restoration, that's a time that I notice people talk about sex and sexuality, and their desire comes back, and it is a positive thing, telling us, oh God, that they are recovering. Because I think misconception that many, at least my female clients have, that only if I have the body like that, I would want to have sex all the time. But then if you are in that starvation mode and your body is starved, then you will experience hormonal changes, and sexual desire is not as present for you. So that's been my experience. I've seen it in both men and women. But good news is when they work through some of the eating disorder behaviors that they have, and they restore weight, then the issue kind of gets resolved or gets less of an issue.
Yeah, and that just, it's kind of, the proof is in the pudding there, that you can't deny at that point that nutrition has a huge part to deal with a lot of this. And it's because, a lot of those vitamins and amino acids that we need, that we eat are needed to make, dopamine, adrenaline, oxytocin, all these things that are involved in sex. I do want to touch up on one mineral that is very important for this discussion, and particularly for women, and that's iron. And so a lot of folks don't know that iron is actually needed to make dopamine. And so, most women do kind of deal with chronic iron deficiency. So if that is something that you are kind of struggling with, you definitely want to make sure that that's well treated, and that will improve your sex life for sure by virtue of allowing more dopamine to be made in your brain. One sign that someone is very low on iron is that they start to develop restless leg syndrome, because dopamine is involved in different pathways in the brain. And for example, people with sleep apnea who their oxygen drops in the night, well, their body perceives that they're low on oxygen. So their red blood cells will increase and use up all the iron. And that iron is not available to make dopamine, and that causes problems. The first place we see it is in their motor system, and that's why they'll, toss and turn, they'll kick their legs at night. And often I see that those patients of mine, that they have some depression and they have some sexual dysfunction as well. But as soon as I replace the iron, all that goes away.
And what you mentioned, I think was very interesting, that kind of reminded me of, as you mentioned, like lifestyle changes, that like if you're eating well, you're sleeping well, you're moving your body, then some of the issues perhaps can get resolved, because sometimes what we do in therapy is helping people to improve their lifestyle. And like you'll get surprised, and when you have a balanced meal, you move your body, that how impactful that can be.
Yeah, definitely. For men, circulation, that's the main issue. Like you said, get up, get moving, let your blood flow in your body better, and then you're going to, achieve much better erections, In fact, I watched a documentary recently on Netflix, We Are Champions, where a lot of athletes were talking about a plant-based diet, and a urologist had some pro athletes or college athletes where he measured their erections while they had a meat-based meal and compared it to when they had the plant-based meal. And it was really interesting, even though it's anecdotal, but when they switched to a plant-based diet, that they did have longer erections and they were able to sustain them a lot better, So, lifestyle has a big part to do with this, definitely.
Fascinating. I definitely need to check that documentary, because it seems like it was such an interesting information on the different kind of nutritional aspect of different diets. So Dr. Mohebbi, I know you've been super generous with your time, and you covered many of the wonderful topics and important topics that are on mind of many of our listeners. So if they want to gather more information about medication, kind of like articles, I know you post so many interesting things on your social media, what would be the great place for people to go to find you?
Yeah, so you can find me at Dr. Mohebbi on Instagram. So that's DrMohebbi. Would be the easiest place to get a hold of me. And like you said, I'll post a lot of these reviews that are new and are out there, because it's hard for the general public to kind of find what is the level of evidence that we look at in the scientific world compared to what's out there on the internet, So I'm happy to share the information with folks. I'm all about patient education.
Excellent. Thank you so much, guys. If you didn't get a chance to write down Dr. Mohebbi's handle, it's going to be on the show notes. And also, he was very generous that he shared with us some of the references for the conversation that we had today. Dr. Mohebbi, as always, it was a pleasure to have you on the show, and thank you so much for sharing your expertise with us.
Thank you. Thanks for having me. Bye-bye now.
I hope you guys found our conversation useful and it gave you good information about some of the medications that are out there. I wanted to share with you that starting first Friday of September, I'm doing this cooking challenge on my Instagram account. One of my supervisors, when I was doing my sex therapy supervision and certification, she wrote this recipe book, it's a cookbook, and it's focused on enhancing your sensuality and steering your libido. So she's a sex therapist. She did this research on how to incorporate food in increasing your sexuality. So Linda is a sex therapist, but also she curated this recipe book focusing on foods that will enhance your sexuality. I will post the recipe, the ingredients on Thursday nights, and we'll make it together on Friday. And if it happens that you're cooking it and you want to share it with me, you can just tag me at Sexology Podcast. All right, I'll talk to you guys next week. Thanks for listening to Sexology Podcast. For more great content, visit www.sexologypodcast.com. Please be advised that information presented on this podcast is not a substitute for seeking help from a licensed mental health provider.